For Michael Nicolois, a high school student from Queens, New York, the ordeal begins last Thursday when he starts to feel sick.
I had a headache, had some body aches.
There's clearly a bug going around his school, St. Francis Prep.
On Thursday, it was a lot of kids at the nurse. I think it was like 80 or 75 or something like that. But yeah, it was wild. There was chairs outside the nurse's office with kids sitting there, and we were like we had no idea what was going on, so it was strange.
Michael doesn't know it, but health officials down in Mexico have been scrambling for weeks to deal with a mounting outbreak there. One they're just confirming has spread to a handful of patients in California and Texas. It is only the next day that Michael and his mother first hear the term swine flu, and they learn that some of Michael's fellow students have recently returned from a trip to Mexico, where on Friday, health officials announced that they've now identified more than 900 suspected cases. Anxiety is setting in among Mexicans. Schools are being shut down. Masks are everywhere. Meanwhile, back in the U.S., the FDA is starting preliminary lab work on a possible vaccine against swine flu.
Mexico and
Friday night, Michael and his mother go to the hospital. So did either or both of you have a moment where you were a little freaked out?
Yeah, I was in Long Island when he called me and said that the school was shutting down, they were coming in to sanitize it, and that they think some of the illnesses might be swine flu. And his next thing was, maybe I don't have allergies?
yeah.
So I raced home from Nassau County, picked him up, and we went right to a city hospital.
Yeah.
And were you a little scared?
I was a little scared.
Saturday, Mexican health officials say there are now 1,300 suspected cases and 81 deaths. In the U.S., the CDC is reporting 11 confirmed cases, all of them mild, in California, Texas, and Kansas. Around the world, governments are starting to react, setting up monitoring technology at airports and, in some places, announcing plans to quarantine sick passengers. Sunday, the virus truly goes global. People are testing positive in New Zealand, and there are suspected cases in France, Canada, Scotland, Israel, and Spain. Mexico City is on something approaching a lockdown. Churches and public parks are closed. A soccer team is playing in an empty stadium. Back in New York City, Mayor Michael Bloomberg holds a news conference outside of Michael Nicolois' school, St. Francis Prep, and he announces that 8 students have tested positive for swine flu.
And today we can tell you that, as we anticipated, the CDC has confirmed the diagnosis of swine flu in children whose samples we sent them.
It appears that Michael is one of them. And at that point, how were you feeling?
I was, I was a little freaked out, but I kept telling myself, I feel fine, so I shouldn't even be worried at all or anything.
Hours later, the Obama administration declares a national public health emergency, but urges Americans not to panic.
We do think that this will continue to spread, but we are taking aggressive actions to minimize the impact on people's health.
Shortly after that, however, an official with the CDC says on a conference call with reporters that she fears that Americans will die from this virus. Was that an appropriate thing to say, even if it's true, given the atmosphere of fear right now?
Members of the Public Health Service have made comments, very honest comments, about the reality that there's a probability that people are going to die from the swine flu. After all, what are the odds that over 100 people will die of the swine flu in Mexico and not one in this country? And isn't it a little dishonest for us to get people falsely assured that there'll be no deaths from a virus that most of us in our hearts feel may be dangerous enough to cause death?
Today, Monday, in Mexico, the suspected death toll rises to 149, and the clampdown continues. The Mexican government orders schools closed across the country until May 6th. Back in the U.S., President Obama weighs in for the first time.
And this is obviously a cause for concern and requires a heightened state of alert. But it's not a cause for alarm.
This afternoon, the mayor of New York holds another press conference and says 20 more people, including students and a teacher, have tested positive, but that these were all people suspected to have the virus anyway.
This remains an isolated incident. There is no reason for anyone outside of the St. Francis community to stay home or to change their daily routine unless they are sick. Everyone should go to work and go about their day, and no one who is planning to visit New York City should think twice.
A sentiment echoed by Michael Nicolois, who insists he is feeling fine.
I have to say, I haven't seen you on a day when you haven't been diagnosed with swine flu, but you look pretty good.
I feel pretty good, yeah.
All this anxiety that's going on in the country about swine flu, what would you like to say to people who are very worried about this?
Stop worrying about it.
I would say, obviously, you have to be concerned. You have to, your hygiene has to be good. You can contract the common cold much, just the same way you contract this. And his symptoms were very similar to the common cold. And luckily, I could see him engage that through all of this, because what we were hearing and what we were seeing were two totally different things.
Moments after this interview, however, the World Health Organization raises the pandemic alert to 4, meaning that there is now a greater threat of a major global outbreak, although there is no guarantee that it will happen.
When and how will we know how serious this is going to be?
The next 7 days are absolutely critical. Either the number of cases in Mexico will rapidly accelerate, we'll see more deaths, and we will realize all the different mutations that this virus can adapt to, or it's going to plateau. If it plateaus, we're done. The incidence in America will continue to increase probably for another week or two after that, but slowly drop off as people get smart and stay away from each other. But if it's the former scenario where we have a rapid increase in Mexico, then it's not just the United States, but the entire world that will become concerned.
Bottom line, while Michael Nicolois' case is reassuring, we are not out of the woods yet. For Nightline, this is Dan Harris in New York.